Hi, my name is Dr. Alex Haynes, and today we're going to be discussing erectile dysfunction and men's sexual health in general.
What are the common causes of erectile dysfunction?
So when it comes to erectile dysfunction, similar to like libido, you have to ask, is it a physical problem? Like, is there a problem with my body itself? Or is there like a psychological problem? Is there an emotional issue? The main cause of erectile dysfunction has to do with decreased blood supply to the penis. So vascular issues is one of the main causes. And that's where a lot of the current market standard drugs are set, like your Viagra, like your Cialis. It's aimed at increasing the blood flow to the penis. So if we first talk about physical problems for erectile dysfunction, one, let's first talk about like the problems with your body. It's hypertension, diabetes, obesity, and lifestyle problems. Those are the main causes of erectile dysfunction as one person gets older. The reason that these diseases tend to cause erectile dysfunction has to do with the damage to your blood flow in your body. So hypertension and diabetes, these conditions affect your blood vessels in your body. So let's first speak about diabetes, for instance. A problem with diabetes is that obviously you have too much sugar in your body, and this increased sugar damages two things. It firstly damages your big and small blood vessels, and secondly also damages your nerves in your body. So patients with diabetes will experience erectile dysfunction due to things like damage to the blood vessels directly, and also damage to the nerves to the penis, so their sensation is decreased over time. What happens is, in all these diseases like high blood pressure, obesity, diabetes, and hypertension, is that your body produces less nitrous oxide. And nitrous oxide is an extremely important chemical in the body that we'll definitely chat a bit more about later. But nitrous oxide is responsible for the vasodilation, so essentially your blood vessels getting bigger, not only in the penis but also in your heart supply, in your lungs, and in your brain as well. So if you have a decreased supply of nitrous oxide, your blood vessels aren't expanding enough, and if your blood vessels don't expand appropriately, then you're not going to have sufficient blood flow to the penis in order to sustain a necessary erection. So smoking is a very big risk factor, also because it damages your vasculature in your blood, so your blood capillaries itself. So the other problem as well can be emotional reasons. If someone is going through a stressful time, they're not going to be experiencing the desire to have sex. And if you have a decreased desire and decreased libido, that directly can affect your penis and the efficiency to maintain erection sustainable enough for intercourse. So psychological issues as well. If you are depressed, if you are anxious, it actually decreases the level of testosterone in your body, and also increases cortisol levels. So stress is one of the most common psychological issues around erectile dysfunction. The reason is, when you're stressed, your cortisol levels increase in your body. And when your cortisol levels increase, it actually directly inhibits your testosterone. So increased cortisol levels are related with stress. If I'm stressed, if you're stressed, your cortisol, your stress hormone in the body, essentially increases a lot. And that directly brings down your testosterone level. And testosterone is a very, very necessary hormone for achieving an erection and maintaining an erection. So those are some of the most common causes of erectile dysfunction.